The reason there are arrows going up and down for the push for use of lower cost drugs is that clearly with more patients, more treatments going on, there is a drive to contain costs, a drive to keep prices as low as possible. Local companies, particularly those marketing branded generics, are subject to those pressures as well. But clearly, a high quality generic product will do well because there is a market for it. And those two illustrative red boxes at the top there, the price cuts imposed by the Saudi FDA, who are becoming much stronger in their views, well, it's a pressure on everyone, but of course it is something in favour of companies who can manufacture high quality pharmaceuticals in the GCC, of course, which has preferred regulatory status, and equally the establishment of NUPCO, not necessarily that organisation itself, but also as a symptom of cost pressures within the Saudi market. Again, efficient companies producing products in modern, efficient factories will do well because their products will become ever more attractive. I'm going to skip over these next few slides, but you will be able to review them in detail. They provide a little bit more detail about some of the comments I've made already. So the investment of the Saudi government in improved access to healthcare, and you see both infrastructure and treatment implications for that. And in terms of growth, the growth so far in Saudi Arabia, considering its size, has been fairly healthy, but we would anticipate that will accelerate. So if you see in the grey bars are from now on, we're seeing that market grow up about 9%. That's good growth. It's not up to the level of China, for example, and some of the smaller GCC states may have growth faster than that. But given the size of the Saudi market, as I said, 2/3 of the overall GCC, this is a very, very positive signal for pharmaceuticals in this region. There are constraints, as I said, prices. There is pressure downwards on prices and pressure to use generics. Now, I'm not here and I'm not proposing that local companies just confine themselves to branded generics, although that is mainly where they are at the moment. There are certainly some who are making a significant investment in innovative products of a particular kind, but clearly that trend is something that needs to be encouraged. And my view is, and I think that is the thinking behind the organisation of this meeting, is that there is a better chance of that succeeding with a collective commitment from the stakeholders, both at government and institutional level, to make that happen. And that will, of course, benefit not only the large companies, but also the small companies as well. I was speaking with someone earlier about the benefit. You may think that life is on the side of the big companies, the huge companies like GSK and Pfizer globally, or some of the major local manufacturers like Spumako and others. But of course, those companies, as I've said previously, flourish in an environment where innovation is going on wherever. And clearly those companies have an infrastructure to sell products, but they don't care. If the products are created and developed by small R&D houses or small companies, and they can help to promote them and market them, then that's good for everyone. So I think I absolutely support the collective will and the collective direction which this group is capable of giving to GCC pharmaceuticals. Looking at UAE, it's rather a different picture, with very much the emphasis on the private market, and a number of dynamics in terms of its growth. UAE is an outlier, really. It is, for a relatively small population, it is a very, very valuable market. Clearly there is a limit to the size of, given the population size, there is a limit to its growth, but the investment there is extraordinary. And of course the investment in healthcare provision and healthcare technology is reflected in the establishment of places like Dubai Tech and Dubai Healthcare City, and there are other investments, as you know, elsewhere in the Emirates. Now, UAE's growth has been nothing short of spectacular over the last few years, but it's from a relatively low base. We would expect that to moderate somewhat, but it still represents an important market. And of course, Saudi Arabia and UAE are markets where there are some local players who are doing extremely well and are very good at what they're doing. So I'm just going to conclude there for this section, but we will be coming back to some of the issues, and I want to just highlight a number of points. First of all, GCC pharmaceutical markets have shown and can be expected to show sustained growth. The conditions are right. Now, there are plenty of markets around the world which have had their moment of growth, and there are questions, particularly in the current economic climate, about whether they can be sustained. There are certain markets in Latin America, for example, where the past growth is unsustainable. I think in GCC you are in a very, very, very good position. But of course, with that opportunity becomes responsibility, because you want to improve ultimately all these numbers, all these financial figures. The ultimate aim must be to improve healthcare for the inhabitants in this region, and also to improve the technological pharmaceutical base in the region, and I think that's what we would favour. Significant investment has already taken place, and that will continue to drive things. However, with a few notable exceptions, local manufacturers have gained a relatively low proportion of the value of the market so far, at the expense of the multinational companies. There are some companies who are very, very effective at sales and marketing and at developing and formulating products. But generally speaking, they are generic products that they are marketing, and or products that have been licensed in from international companies. So, and this doesn't mean to sound critical, but if you go back to the value chain chart that I had at the start, there is plenty of the value chain in which GCC companies do not currently have a major stake in. And I believe that there is definitely an opportunity. You will be starting from a low base, but I think there are clear benefits to the region and to the healthcare within the region if they are pursued. And I think as a follow-on to this project, to this presentation, a bit later in the morning, Jürgen Reinhardt from UNIDO and myself will be facilitating a session where we try and draw the strings from what we've heard this morning to actually identify where collectively you believe the focus of attention should occur. Thank you very much indeed.